A transplant is a life-changing operation. Once your kidney function is stable, you should have more energy and be able to get back to your usual activities. It's important to remember that everyone's recovery is different, but support is available. Some recipients need support for their mental health. Why might I need a mental health assessment? Like any major operation or illness, transplantation can lead to emotional consequences. These are often positive, especially if the transplant works well. But some people experience anxiety, panic attacks, depression, or other problems. Usually, these experiences settle with time and support from the transplant team through their regular follow-up. But sometimes they cause enough distress to require treatment in their own right. This is where mental health specialists attached to the transplant service might come in. If this happens to you, you may be referred to a psychologist or a psychiatrist for an initial assessment interview. It does not mean the transplant team think there is something wrong with your mental health or that you're not strong enough. If you have heart problems after transplant, you may well be referred to a heart specialist. It does not mean your heart is giving out. What happens in a mental health assessment? The assessment is undertaken by interview, which can be in person or by video. It usually lasts an hour or so. Sometimes additional interviews are necessary. There may be questionnaires and rating scales to complete. The mental health specialists do not normally arrange blood tests, x-rays or scans themselves, but will be able to see the results of tests arranged by other members of the transplant team. The person you see will focus on any current difficulties you may be having, as well as your medical history and other aspects of your personal background. The results of the assessment will be fed back to you, as well as to the transplant team, your GP, and any other relevant medical professionals. The mental health specialists may also attend meetings of the transplant team where your case is discussed. What happens after mental health assessment? Assessment may lead on to a recommendation for treatment, either as talking treatment, medications such as antidepressants, or both. There may also be referrals to other services. These might be local NHS teams, non-NHS community services, or online supports. The mental health specialists will liaise with the transplant team and your GP to ensure any treatment you're offered aligns with your transplant follow-up and medication. The assessment findings and treatment recommendations will be fully shared with you. Who does the mental health assessment? The specialist you see might be a psychologist or a psychiatrist. Either way, they're experienced in seeing people with kidney problems before and after a transplant, and they work closely with the kidney transplant service. If you've had a pre-transplant mental health assessment, it's likely that if you needed support after transplant, you would be seen by the same person.